Are you getting ready to have a baby? Today, I'm going to share with you 5 things that you really need to know about your body because it is giving you clues about if your body is ready to conceive. Today, we are going to talk about your period. So, this is something that a lot of women I see don't really know much about in their clinic, and one of my missions is to empower you about your body. So today we're going to talk about all those things. So get ready, okay? So what's one of the things that's really important about your cycle? We're going to talk about what your cycle should look like, how long it should be, the color of your blood. We're going to talk about what that can mean and different ways that you can improve it, and the quality of it, how long you should be bleeding, and what that should look like, and then also ovulation. So first of all, you may know already that your cycle, the best cycle length is to be around 28 to 29 days to be optimal. And the reason is that gives your body the perfect amount of time to allow that egg to mature, release, and have the best chance of getting pregnant. It's the perfect balance for your menstrual cycle. So what happens is if your menstrual cycles are short, the follicle may not be able to mature long enough, and so you may not get the best quality egg, and you may have a chance of not fertilizing because it may not be ripe enough, if you will. So what's important is if your cycles are short, especially if they're short, like 25, 26 days, then we would want to do things to lengthen them, and that can happen. So we want to do things to nourish your body so that you can lengthen your cycle, so that you can increase your chances of getting pregnant. Because if you have a short cycle, you actually have 75% chance of miscarrying. So we really want to make sure that you're lengthening or having a normal cycle. The other thing is if your cycle is really long, what can happen is then you're not ovulating soon enough, so then the egg sits there too long and it gets overripe, and it can also increase chances of miscarriage because it increases the chance of chromosomal abnormalities. So if your cycle is really long, we want to definitely make it shorter, around that 30-day window. 28, 30-day window is really going to be optimal and a nice balance. So that's going to be the first part, is the length of your cycles, and be really important. And if you have irregular cycles, or if you have long or short cycles, it absolutely can be corrected. So and we can support you with that. So be sure to share this video and give us a thumbs up. And if you would like some support with regulating your menstrual cycle, then just go ahead and reach out in the comment section below, and we could set up a consultation, or we could send you some information that can support you with that, okay? So the next thing we're going to talk about is what should happen when your period starts. So a lot of women have really bad PMS, they have really bad pain, and sometimes they just don't feel like themselves for the whole half the month. And that's extreme. Thank God most women aren't like that, but you definitely don't have to have severe pains and mood. I'm going to call it a mood disorder. I mean, you don't need to be, some people, you may be feeling really sensitive and short and cry at the, all those commercials, or you may be feeling like really irritable and short and snapping at the people that you love the most. And I know it's going to make you feel really bad if that's happening for you. You don't have to do that. It can absolutely be corrected. So you shouldn't have that. That's a sign that there's an imbalance going on, and it can be corrected. The other thing is that your period should just come on. You definitely want to have some sensations going on in your lower abdomen, or where you're feeling it. But again, if you're having them in your lower abdomen, or if you're having them in your back, that gives us a sign about what's going on in your body, and we can correct that. So you want to have sensation because there's a lot happening during your menstrual cycle. There's a lot going on in your body, but you don't want to have pain. So what should happen is your period should come on. If you spot a little bit before and then it comes on that that's fine. If you're spotting a couple days before, that's given us a sign that there is an imbalance. And also if it kind of like keeps spotting longer and longer. So what technically should happen is you would be optimal to bleed about 4 days, 3 or 4 days. 4 days is a little bit better. And you want to change your pad or tampon, and hopefully you're using organic pads or tampons, because of all the chemicals in our feminine products, ridiculous. But you definitely want to be using a organic pad or tampon, or one of those disposable, not disposable, reusable pads. Those are going to be really great for you, especially for the environment if you're going that way. But either way, just use the ones that don't have the chemicals in it. Thank God we're moving that to that direction, but we're really in the grassroots of that. So that's going to be really important. Okay, so sidetrack, but anyways, really important tip. So it's ideal to change about every 4 hours, you know, a regular size or super pad or tampon. If you're, you know, changing, but you really didn't need to, then that's sending your body a message that you're not getting enough blood to the area. We really need, at that point, we'd really need to build the blood, is what I say. So you want to nourish your body with foods that are enriching for building blood, like beef or beets and spinach, and, you know, things that are really nourishing. Bone broth, those are going to be some things that are going to be really helpful for building and nourishing your blood. The grass-fed beef, by the way. So that's going to be really important. And then your period, again, should stop. And maybe you'll spot for a little bit, but it shouldn't spot for days. So again, it's going to be showing an imbalance. So be sure to share this video, because this is really important information. Even if you're not trying to get pregnant, let's learn about our bodies, right? It's time to learn about our bodies, because it's really great information. Okay, so that's going to be the next thing. So first of all, you want to have a 28-day menstrual cycle, and around there, 28, 30 days. Then you also want to just have your period just come on. You're going to feel sensations that it's coming on, but you don't want to have anything that's debilitating. You don't want to have anything where you think you need to take some ibuprofen or whatever you take for that. You're going to use that as a sign that there can be a correction there and an imbalance, because you want to get good blood flow. You want to get healthy blood flow. So that's going to bring me to number 3, which is the color of your blood. So the color gives you more information. And if you're having really dark blood, purple blood, a lot of clots in it, then you're going to really want to get some more circulation down there. So things like acupuncture, castor oil packs, exercise, eating healthy. I mean, there's so many things you can do so that you can get healthy blood down there. And that's why I'm a big proponent of eating clean, because when you eat the food, you're getting the nutrition to go into the blood to circulate and nourish your whole body, but also your eggs and your uterus. So it's really important to have that really good nutrition. But then you need to have good circulation, right? So that's going to give you a sign that there's, like, we call it stagnation. So we got to get some circulation in there. The other thing is, if the color of your blood is more lighter or pink, then it's a sign that it's not good. It's not rich enough. It doesn't have enough nutrients. So you're going to want to rebuild on that. Again, going back to your diet and your supplements. So that's going to be really important for you. So we have the 28-day cycle. We have the having no pain, just starting and bleeding for about 4 days. And the goal would be to really change, or getting close to. Again, that would be the ideal. But even if you're close to those parameters, then you're going to be good to go. The color of your blood is going to be also an indicator. You're not having too many clots, having nice fresh blood. And then also the viscosity of the blood is important. Is it sticky? Do you see it like really stringy and sticky? Or is it, you know, really like the texture or the viscosity of blood? Sometimes it can be really watery. So those are going to be really important signs for you as well. So if it's really sticky, then maybe you need to hydrate, or maybe you need to increase your fats, or maybe both. So again, that's something that can be just tailored to by diet and supplements alone right there. So the next thing I would like to share with you is about ovulation. So what happens is you have your menstrual cycle. Then after you're done bleeding, you should feel a little bit dry. And then when you're, then what your fertile mucus, or not your fertile mucus, you'll start to produce mucus, and you produce mucus for different reasons. Or the cervical fluid is, I guess, a prettier word. Not that it's pretty, but it is pretty. Actually, it's our bodies. So first it's a little bit dry, and then you're going to get like a little bit of a thicker mucus, and that's really to prevent the sperm from entering. It's going to make it really difficult for the sperm to enter during that time because it's going to be thick because your body's not ready to get pregnant. So then it'll start to get a little bit more watery, and then you should get this nice stretchy fertile mucus that's been barky, that's giving your body a sign that you're ready to, your body's ovulating and you're ready to go. And then you have another form that's usually produced a little bit higher up in the vagina, up in the cervix, but you may get some of that discharge or not, and it's really like supercharged the sperm. It's really powerful. So it's normal to be dry after your menstrual cycle. It's also normal to start to get a little bit dry if that happens, or it's not normal or abnormal, but it's important to know that it is okay if you're a little bit dry even as you get closer to your menstrual cycle. So, but definitely after your menstrual cycle, dryness is normal. So if you are dry, you want to make sure that you're using a lubrication that is safe for fertilization. So, and one that doesn't have parabens in it. So make sure that you're using a safe lubrication if you're using lubrication. It's going to be very important. Okay, so I think that is all the things that I want to touch base. So let me do a quick recap. And again, please give us a thumbs up and share this video because it's really important information for you if you're trying to get pregnant. But even if you're not trying to get pregnant yet and you just want to learn about your body, this is going to be really important information for you. So because it's telling you signs, and you don't want to have pain. You want to have nice fresh blood. You want to create a really good environment, a nurturing environment. Kind of makes sense, right? So you want to have a 28-day cycle. You want to make sure that the color of the blood is nice and fresh. You don't want to have any pain. You want to make sure you're getting a good fertile mucus around the time of ovulation. So that's the other key, is you want to make sure you're getting it around the time of ovulation. So when I work with women, sometimes we discover that the fertile mucus comes before, and then by the time they ovulate, it's all dried up. So we need to correct that. So that's really important information for you too. All right. I think that should be my recap. So here's to your fertility. And please, again, share this video so we can help more women. And if you're interested in working with me or seeing how I can help you, then just go ahead and put in the chat box or in the comment section below that you would be interested in having a 20-minute consultation, and we'll reach out to you, or you can just go over directly to our website and connect with us, and we will support you and help you any way we can. So here's to your fertility. Bye-bye.